Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going to go over facial feminization surgery. I thought it'd be interesting to talk about one of the icons of this movement in surgery, which is Caitlyn Jenner. It's interesting for her because it is such a transition. She went from an Olympic male champion to a champion for the transgender movement. Caitlyn's entire family has been open about plastic surgery, and so I think in one way that kind of opened the door a little bit for her. In other words, gave her a little more of a comfort zone, that her friends and family were open to it, made her maybe a little more open to it, maybe a little more open to talking about it, being in the media. I think that makes it easier for everybody to talk about it. So today I think we're going to go through some of the things that I saw Caitlyn doing and transitioning. And I think even before announcing the transition, she was doing surgeries before people might have said, uh-oh, it's making you look a little more feminine, but maybe that's what she had in mind, all along. So I think even the earlier surgeries that were done maybe for more rejuvenation also had a little bit of feminine touch to it. So if we look at Caitlyn's earlier surgeries when she was younger and not yet publicly transitioning, you can see that she was doing things as far as changing her nose, making it more feminine, shrinking it down, multiple rhinoplasties, and of course that's going to make it look a little more feminine by shrinking it and making it smaller. Doing the facelifts, doing the rejuvenation surgeries, not necessarily make you look more feminine, but in that case maybe a touch, because again, lifting the cheekbones, adding volume to the upper face, tightening up the neck, also made her look younger. But again, we see some lip fillers, different things, again, that lead toward a little bit more of a feminine look. So I think some of these things may have been going on for many, many, many years before making the public announcement. Some of the surgeries that Caitlyn had done before publicly announcing transitioning, to me appears that there was upper eyelid surgery or upper blepharoplasty that opened the eyes up. Again, maybe making her eyes a little more feminine at that time. Multiple facelifts, contouring of the neck, adding volume to the cheeks. All those things I think were meant to make her look younger, but also made her look a little more feminine. Obviously the multiple rhinoplasties, shrinking the nose, also the lips, all of these things, as you can see throughout the years, really added up to a slightly more feminine look to Caitlyn before jumping into the major surgeries. And I wanted to go through that a little bit because I think the history of it's somewhat interesting, I think, of how these procedures evolved and how fairly new they are. Many of these procedures that she may have gotten earlier were exactly that, rejuvenation procedures, and not necessarily feminization surgeries. Now they may have morphed into that over the years, but it wasn't until the early 1980s that this sort of class of surgeries, the feminization surgeries, was really born. And the way that was done was there were some surgeons in San Francisco that had a lot of transgender patients that were interested in looking less like men and looking more feminine. There was a surgeon, Dr. Daryl Pratt, and another Dr. Douglas Osterhout. And what they did was started looking back through, sounds interesting, but through skulls and cephalograms, or those are images of skulls, looking at what is the difference between male and female anatomy, facial structures, what is the difference, how can we change a face or bodies in order to make them look more feminine. And so that kind of is where facial feminization surgery was born out of. And so when we're looking at the faces of patients, we're looking from top down. We're looking at the brow, what's different in a male and female. And in a male, we're seeing a stronger frontal bone here, what's called frontal bossing. You can think of people like Jason Momoa or Aquaman, very strong frontal bone, very masculine features. That's more of a masculine feature, male feature. Female, softer brow, less of that frontal bossing, just a much softer looking brow, as well as the hairline. Obviously, male hairlines tend to recede a little bit more than female hairlines, so lowering the hairline, reshaping the hairline again can make somebody look more feminine. Then we look at the midface. Obviously, again, we're looking at cheek highlights, the apple of the cheek. More feminine feature is more of that apple of the cheek highlight, giving that look to the midface of just a more feminine look. Then if we're looking down towards the lips, again, female lips, a little fuller, a little shorter distance between the upper lip and the nose. Again, those things making somebody appear more feminine. And then looking at the jaw, the width of the jaw, the shape of the chin, all of these things, the more width, The more rounded out and strong the jawline and chin, again, more masculine. And then one of the telltale signs that everybody picks up on is the Adam's apple, right? The tracheal prominence. And so again, with testosterone, that grows in male patients, and they tend to get a prominent Adam's apple, and in females not as much. So that's one of the, again, signs that we're looking at overall, subliminally, subconsciously. When you're looking at somebody, they appear more masculine, appear more feminine. It's these little kind of adjustments that can make a big difference. So that's a little bit about the history of facial feminization surgery. So now, how does that translate to Caitlyn and what she's done? There's been a lot of coverage of her most recent surgery that was a little bit more extreme, and I think it was a positive move because it took her from being a little bit more androgynous to much more feminine. And that's the whole purpose of feminization surgery. So if we looked at and kind of broke down her face and looked at the upper and lower thirds and middle thirds of her face to see what changed, they didn't say exactly but what the surgeries were, but you can definitely see the changes in her face. So if we're looking at the upper part of the face, or upper third, and the brow and the hairline, I do think that the brow has been lifted. You can see that it's a much more feminine look. The brows are arched and raised, and the eyes are opened up. All of those much more feminine features, softening of the brow. Probably some fillers of fat grafting in certain areas, again, to soften features, make the face look more feminine. One thing I do notice as well is the hair might be thicker. Now there's different ways to do that as far as either lowering the hairline or thickening the hair. Some are surgical, some are not surgical. One of the things that can be done are hair grafts, right, to thicken the hairline, lower the hairline. And then there are some newer treatments such as PRP or growth factor injections into the hair, or stem cells into the hair, exosomes, things like that. And what those do is stimulate the existing hair to thicken up and grow in thicker. So maybe a combination of those different things were done to the hairline, as well as lifting that brow. There are also brow procedures where you can raise the brow and lower the hairline at the same time by doing an incision in front of the hairline. So it could be a combination of all those things. But overall, you can see that change in the facial expression is much more feminine and also rejuvenated, looking younger and rested. So I think that was a positive move. If we look at the mid-face into her cheeks, again, the cheeks appear fuller, a little more of a cheek highlight, lifted, again, much more feminine features, that classic OG heart-shaped face. So I think, again, a move in the right direction. And we look at the lips, again, fuller. I don't know about a lip lift in Caitlyn. It's a possibility where the distance is shortened and the lip is turned up and a little fuller, but in the very least, fillers or some sort of fat grafting or fillers in the lips to plump them up and, again, make them appear more feminine. And in the lower face, jawline contouring. Now there's different ways of doing that. There's things where you can actually shave and contour the chin, or there's more just facelifting, tightening up the skin, contouring that jawline, giving it a more elegant, feminine look to it. I do think a possibility, again, in the masseter area, the width of the jaw, maybe slightly nearer, more feminine as well. Caitlyn used to have a much stronger jaw. I think it does appear a little bit more feminine. Now that can be done surgically, again, to reduce it, or secondly, just injecting Botox to shrink the masseters and contour that jawline into a more slender appearance, a more feminine appearance. And then lastly, we're looking at the trachea, or the Adam's apple. There are rumors that it was shaved or brought down, and that's a very common female feminization surgery, to shave down that trachea. I think it's interesting because behind there are actually the vocal cords. So when that testosterone in that trachea grows, it actually deepens and stretches those cords and gives a more masculine voice. So when you just shave off the trachea, the voice actually stays the same, but the actual trachea, or the Adam's apple, is shaved off to give, again, to the eye a more feminine appearance. You can't forget about the body. Right, so what the body does, or the face does, we have to make things match. It does appear that Caitlyn also had a breast augmentation. And again, with the body, there are certain things that look more feminine, things that look more masculine. So if we're looking at the shape of the hips, wider hips in females, more contour hourglass shape. Just to clarify, I'm not saying that I think Caitlyn did a Brazilian butt augmentation or contouring the hips. I haven't seen any particular photos on that, but I'm just saying in general, three main areas: the face, the body, and the hands. Those are the three big areas that people see a lot of that are outside of clothes and people pick up on. So I think when looking at those things, are three things people really look at when they're doing feminization surgery or rejuvenation surgery. So, rejuvenating the face, feminizing the face, the body, and then the hands. And one way to do the hands is to soften the hands. You can do fat grafting, fillers, things to give that appearance of more feminine but also younger. I think that Caitlyn has achieved her goal. I do think she appears more feminine. and actually a little younger. I think the surgeries have moved her in the direction she wanted to go. I do want to say one caveat, which is with these sort of feminization surgeries, I think she did more of an extreme surgery, a lot of surgeries at once. She mentioned that she got anxiety from that. So I do want people to know that are thinking about these type of surgeries that, again, maybe a more gradual change is sometimes more appropriate, because it is a little bit of a shock to the system when you do a lot all at once, psychologically, emotionally, just dealing with all of that change. As well as some of the surgeries, as they're becoming more aggressive and more extreme, they are a little bit more irreversible. As people are making that transition, just take it gradually, really think about the surgeries, what you're trying to achieve, and then those extreme makeovers, again, just be prepared for that, because that can be a little shocking when they're done all at once. Overall, I think, again, Caitlyn has achieved her goal. I think she does look more feminine, and I think a caveat is also younger, so I think as long as she stays on this track and doesn't go too extreme, I think this was a move in the right direction for her achieving the goals that she wanted, which is to appear more feminine.